I'm excited about today's guest and our conversation today. We are talking about skincare and weight loss with world-renowned plastic surgeon and all-around great guy, Dr. Sean Rice. Hi.
How are you? How you doing?
Good. I was just thinking during the intro, how long have we known each other? Because I remember we met, I think, when we did that ET Canada segment where you did
Yes.
some poke some holes in my face.
Yeah.
When
Yeah, we did the
how long did you
fractionated CO2 laser. I was thinking about that. It's funny. I was thinking about that the other day. It's got to be 15 years ago, I bet.
years?
Somewhere between 10 to 15. Yeah, a long time ago. It's crazy.
Yeah, I can probably credit how great I look due to you. So
Yeah.
when I did this, let's talk about that because people are gonna be like, "What did you do to your face?" And I want to know how like what has happened in like skincare since then. I was starting to get these jowly things.
Right.
I remember looking, and I had for my 4 kids, and I remember looking. It was probably after my last kid, 15, because he's 16 this year.
Right.
I was getting these jowly things. I was, definitely still, I got great genes. My mom looks great. But, when you did that thing where I guess it rejuvenated collagen. I don't know what it did, but it definitely made a huge difference. And I haven't had any really issues with my jowlies ever since.
Awesome. Yeah, as we all age, you lose collagen in your skin and it starts to
Yeah.
sag and you get the jowls and you get kind of all that other stuff. So there's there's literally so many different ways that you look at treating that. The laser we used was a laser based on carbon dioxide, so it was a CO2 laser, and it was fractionated. It was made by Smart Side, called the Smart Side Dot. So
Mhm.
what happens is with fraction, so lasers work in two ways. They work in either fully ablative or they work in what's called fractionated. So think of your skin. Here's your skin sort of sitting here. And then there's sort of that sort of white layer of your skin, what we call the dermis. And then underneath it is the fat and the blood vessels, and then your muscles and bones underneath it. So we need to affect that white layer of the skin.
Mhm.
So the white layer of the skin is what houses all your hair follicles and sweat glands and all that other stuff too. So if you go too deep in rejuvenating the skin, then it's basically a burn, and you can't. The burn has to heal on its own, kind of a thing,
Okay.
right? So we need to
Yeah.
do a controlled burn. So you either take a full layer of that skin off, that's called fully ablative, or what you do is called fractionated. You just poke 1,000 little holes into it. And the difference between the two really comes down to the healing time and
Mm.
what the results look like. So the more you can obliterate, the better your results are going to be, but the longer your recovery time is going to be. If you
Okay,
poke,
so it's more extreme to do
yeah,
the
it's
whole
more
thing.
extreme. Yeah, you poke 1,000 little holes in the skin, and then what happens is the skin heals from bottom up, and then with keeping that skin from the side, it also heals in from the sides. So you don't get as great a result, but you get a much faster healing time, and that's what we did with you, the fractionated CO2 laser.
So how I know we're gonna get into cellulite and crepey skin and all that we're gonna talk about,
Sure.
but I'm kind of into this conversation right now. I'm thinking, I was having a conversation the other day about Young and the Restless and Catherine on Young and the Restless. And this was like, I don't know, 20, 30 years ago, where they did a whole like facelift
Right.
on camera. And we think that when we want to do stuff to our face, we have to like do a whole, like, I don't know, peel our face off and get a whole new face or something like that. Like, I would imagine like procedures and techniques have come a long way, and there's probably a lot that you can do. I know there's Botox and I know there's fillers and stuff, but in terms of kind of rejuvenating your skin, when people lose weight, one, they're afraid of losing that fullness, and
Right.
that can happen for some people. But as we get older, we've done a lot of damage. By the time you hit kind of our age demographic, you've done a lot of damage to your skin. So what are some things that you can do to your face that will actually make a difference, that maybe our members can, or our listeners can look into? They're thinking, I want to, bring back my young face without like, getting major surgery. What can I do?
Yeah, for sure. So, like, if you think about as you age, it all really comes down to collagen, right? So we
Mm,
lose our collagen, and then everything starts to sag. Your cheeks start to sag. You get sort of bigger nasolabial folds, and the one that
yeah.
drives everybody crazy is the tear trough, that kind of hollowing underneath your eyes. You get
Yeah.
that sort of baggy sort of an area. So really, it all comes down to a spectrum. On one side, there's surgery, and then there's non-surgery on the other side, right?
Yeah.
And it really does come down to the quality of your skin. So
Mm.
if you've got a lot of skin and you just got big hanging gels and like a turkey neck, let's call it, then really the only way that's really going to take care of that is surgery. So
Hmm.
let's assume that you don't have a whole bunch of hanging skin and you got a little bit of skin, but you don't want to undergo surgery. There's literally thousands of different ways to tighten the skin. And a
Okay.
lot of them are based on heat. So
Oh,
in order to tighten your skin, you got to get the temperature of your skin somewhere between about 42 to 46 degrees Celsius. And that's the range that will cause what we call collagen neogenesis. So you're basically rebuilding collagen within the skin. The
okay.
problem is if it's too cold, then you're not getting that stimulating effect from the heat. If it's too hot, then you get a burn, and now you're screwed because you burn the skin, right? So you got to find a machine that basically is somewhere in that range that's going to give you some good skin tightening, but not give you a burn. And part of that is the machine, and part of that is the operator dependent, the person doing the procedure that kind of knows what sort of limit they can take you to.
Okay, so obviously finding someone reputable like yourself, because we see these ads all the time. Do this skin melting thing, this
Right.
laser thing, this, fancy names of these machines. Like, how would we know what's what? Like, obviously, this is where we would find someone like yourself. Any tips? Because I know people are gonna ask where to find you, and it's literally the last question. How would
Right.
someone find a qualified doctor like yourself if they don't have access to you? Like, what would people want to look for? What would they want to look out for?
Yeah, I think you have to. So it's funny, it really depends on where you are in the world and what the regulations are there. So let's assume in Canada, at least here in Ontario, you cannot call yourself a plastic surgeon unless you're a real plastic surgeon. There's
Okay.
no more sort of designation as a cosmetic surgeon because anybody can call themselves a cosmetic surgeon.
Okay.
So you can be a plastic reconstructive and cosmetic surgeon, but you can't be just a cosmetic surgeon. So the
Mm.
easiest way to do that would just be to go to whatever sort of area you're in, go to your local, either the plastic surgeons or otolaryngologists or dermatologists, look up the local society, and that'll give you a name of people that are there. In Ontario, just go to the College of Physicians and Surgeons of Ontario, and you can look
Okay.
up somebody's name and find out their true designation. But it's the college is hard to like. You can't really put in plastic surgeon and find me plastic surgeons. You got to kind of know somebody's name, kind of thing.
Yeah. Yeah, right. Okay. Let's get into our conversation today. Our members have been working hard to lose weight in the healthiest of ways. Obviously, they're concerned about skin. When you are losing weight in a healthy way, that definitely helps. And also giving your body time to adjust, things like working out and whatnot. But let's talk about your skin in general, because people always say it's the body's largest organ. But like,
Yes.
what does that mean? Do you know? And why
Yeah,
is
for
that
sure.
important?
Yeah, I think it's funny because people are always worried about your heart. You're always worried about your lungs. Don't smoke, take your medication. But in reality, your skin, and we all sort of take it for granted, is really the biggest sort of organ, the biggest barrier your body has to the outside world, right? Think about it. So if you're looking at really skin health, is how do you keep that barrier alive and
Mm,
well? And still looking good as we all age and go through all the toxicities of the sun and smoking and going to the beach and partying and all that other stuff. How can you take care of your skin in order to sort of keep that going for later on in life, for sure.
yeah. And what are some things that you can do to just on the most basic level to take care of your skin?
Yeah, the basic things is if you're going to do one thing, and it's is sun avoidance. Really,
Mm.
is probably the simple question. Particularly you're going to pay for it or later on in life when you're, like I know when I was a kid, my friends always call me pink boy because I don't tan. I just go red, right? I go varying shades of red, and I'm the guy that sits under the tree, and it's like, oh my god, like you're the. But I know for me, if I sit outside for 15 minutes on the beach in Punta Cana, I'm going to be red. That's just who I am, right?
Yeah.
So basically, avoid the sun as much as you can. Put on lots of good sunscreen. Try not to get burned, and then try to just eat healthy, drink lots of fluids, don't smoke. The standard kind of things that we all sort of know.
Yeah.
And then if you
So
do lose weight, lose it on a we talked about this many times in the past, on a gradual healthy
Yeah.
basis and let your skin sort of retract as opposed to something drastic where everything just sort of drops and hangs.
Yeah. I mean, that's the benefit of our program. We're not a quick fix, and there's so many benefits to allowing your body to adjust to the weight that it's lost along the way and do it in a healthy way. People are going to ask about sunscreen. What's the best one? Do ingredients matter? Should we get it off of, a skincare expert? Or should we get it from our doctors? Can we buy it from shoppers? Like, do we
Yeah,
just put
totally.
zinc? Like, we have so many questions.
Yeah, skincare really. So the big debate on skincare is it's really comes down to two sort of types of skincare. There is a sort of chemical barrier, and then there's a physical barrier. So the
Yeah.
physical barrier is something you put, you get the white cream, you put it over top of your skin, the sun hits it, reflects it off, and away it goes, kind of thing. The other
Yeah.
one, the chemical barrier, basically gets incorporated into your skin, and then
Mhm.
that's how it works on deflect. Let's just call it deflecting the sun rays. So the big debate, and really, I don't have an answer for it. It really comes down to, I think, a personal preference. Some people argue because it is the biggest organ in your body, why are you putting a bunch of chemicals on it, put a physical
Yeah.
barrier over top? I think it really does come down. Me personally, and my answer is whatever doesn't give me a rash is the sunscreen that I use, right? Because I could just get a rash putting anything on. So I use
Yeah.
something. I tend to use something that's higher in SPF, the sun protection factor. So I tend to use something like a 60, particularly on my face, because I know I'm just going to burn. And then I
Yeah.
tend to use something like at least a 30, 40 for my body. And what I find that just works well for me are just and I know it may not be the greatest thing for the environment or whatever the aerosol can, is because I can just get certain areas and I don't have to worry about burning.
Yeah, so more making sure you have some sort of coverage than worrying about what kind of skincare product that you're using at the end of the day.
Yeah, because I think, have you ever read the manuals on skincare, right? Like if you do it properly, sunscreen should be put on, particularly the chemical one should be put on 30 minutes, sometimes even an hour before you go out into the sun.
Yeah.
And then basically you literally, if you read the instructions, it's about the size of a golf ball of cream that you need to put on every like hour, 2 hours kind of thing if you want to maintain the SPF. So it's generally more than you think, and it's certainly more often than you should do it, than you think
Yeah.
you need to do it as well.
So when I remember being in high school, just lying around the pool or whatever, basking in the sun with baby oil and iodine. So,
Totally.
and I'm sure a lot of us did that. So, it
Yeah.
like because I know my next question is asking like about crepey skin and I'm sure that kind of that damage that I did back
Yes.
then is probably leading to this crepey skin. So, what can I get that back? What can I do to erase that? And is that what causes crepey skin? Is kind of like, I'm thinking of that. What about Mary? Did you ever watch that movie? What about Mary Cameron Diaz and the woman? She's so tan. She's like
Right.
just dark, and her
Right.
skin is just all crepey and wrinkly.
Yeah.
Like, can
Yeah.
we?
Yeah, you can see stuff like that too if you're on holidays, right? You see people that are sort of obsessed with the skin, and the skin gets really sort of leathery. And
Yeah,
and really, that stuff you did as a teenager is going to come back to haunt all of us later on in life, right? And
yeah,
I know it. You can sort of see it starting to change. So basically, the best way to prevent it is really prevention. Obviously,
yeah.
is the sunscreen, and don't get burned. Stay out of the sun as much as you can. Make sure you're you put on lots of sunscreen and stuff like that. The other key is just to keep your skin moist. So lots
Okay.
of good moisturizer all the time. Moisturizer, particularly during things like pregnancy, weight loss, and stuff like that. You want to make sure that your skin is moist all the time so that it
Mm.
doesn't crack, because it's the collagen underneath that sort of white layer of your skin. When you lose the collagen and it starts to spread apart, that's where you start to see the stretch marks and the aging and all that other stuff. So you want to keep all that as tight as possible.
Okay, so let's talk stretch marks. Is there anything that we can do? Like, does bio oil work? Do you have special
Yeah.
creams you have access to? Like, is there anything we can do about stretch marks? Because people obviously gain weight. When they lose the weight, their stretch marks are more noticeable.
Yeah.
Is there anything people can do about that?
You know what? If I could come up with something for stretch marks, I'd be a trillionaire by now. Oh my God, I'd be the next Bill Gates. There's a tons of stuff on the market for stretch marks. I've tried everything, CO2 lasers, the whole 9 yards. The problem with stretch marks is this. Let's say your skin is like normally that thick, right?
Yeah.
So now what happens is your skin is sort of this thick, and then it just easily sort of pulls apart, for a lack of a better way of putting it, right? So the goal is to keep it this thick and not let it get to that thick, kind of a thing. So lots of moisturizer, try not to do things on extremes, like weight loss rapidly, putting on weight rapidly. Sometimes you see guys that are big bodybuilders, right? And they get stretch marks across their chest and their arms because their pecs are getting too big too fast. So lots of moisturizer, and take things slow and do it properly. That's really the only way you're going to avoid them. Once you've got stretch marks, if you got small stretch marks, there's lots of things you'd like that fractionated CO2 to help pull the skin and stuff together. But once you've got big stretch marks, honestly, there's very, very few things on the market that are really good at taking care of stretch marks.
Okay, let's talk crepey skin.
Right.
What can we do about it?
Yeah, so crepey skin is, again, sort of thinning of the skin. So lots of things you can do. So you got to think of, what can I do to sort of thicken the collagen, right?
Okay.
So first of all, lots of sunscreen as a preventative measure. And then you got to figure out lots of moisturizer too, some good moisturizer during the day. I've used a lot of like crepiness across the arms, like the upper arms. And you see a lot of women, it may sound strange, but when women that play tennis and they got tennis shorts on and they got a lot of crepiness above their knee, kind of where their shorts are to their knee.
Yes.
So over the years, I've tried everything. We tried CO2 lasers. What I find works really well in those areas are some of the stimulants, like Sculptra. Sculptra is a product called, it's got polylactic acid. It's a stimulant, not a filler. So it's used for the face. I originally started doing, I was one of the first in Canada to do it years ago, maybe 20 odd years ago. We used it for HIV patients, for HIV facial hollowing. And then when that sort of trial, let's call it, Health Canada opened it up to the general population after that, it's probably my favorite. It's not a filler, it's a stimulant, but put it in the category of like Restylane, Juvederm, Reviness, those products, the hyaluronic acid products used for your face and your cheeks. The results will achieve the same, but it's a different way of getting there. You're stimulating the skin. That works really well. I've done it for knees. I've done it for arms. We do a lot for buttock augmentation. It works pretty good for cellulite too in certain areas. And that stimulates your skin. You do multiple treatments, 3 or 4 treatments, 6 to 10 weeks apart. Then you do sort of 1 treatment a year to maintain the thickness of your skin.
So stimulant, you mean you're putting it on your skin and then you're just leaving it there?
Yeah, you inject it just like you were getting your lips done with hyaluronic acid. So it's an injectable, but it's polylactic acid. So think of it this way. You go to the gym and you work out and you get that big burning sensation in your legs, right? And that's lactic acid buildup from lack of oxygen. The lactic acid causes your muscle and your collagen to stimulate itself. That's how you build muscle mass. So what they were able to do is synthetically sort of trick the face into thinking it had a big workout, or whatever body part you inject, re-stimulates the collagen. So you can never look fake with a product like Sculptra. It's not like it's like, oh my God, you see people that come out and their cheeks are way out to here, the lips are way out to there. You can't, this product will just make you look like you did 10 years ago, kind of thing. But it's great for areas that are lacking in collagen to help stimulate it.
Can we buy it in bulk? Where can we get it? How much is it going to cost?
You can only get it through your physician, and then it's an injectable. I've done every body part you can imagine. We've done people that age, and it may sound strange, but people that age lost a lot of weight, even things like their labia, their mons pubis gets all sort of wrinkly and stuff. I've injected those areas. You can inject every area you can imagine.
Okay, I love it. Hey, man, what's important to you at the end of the day? How much would that cost? Give us I know it would depend on the severity of what you want to do, but ballpark, we want to know how much it's going to cost.
Yeah, so let's say you're going to do your face, right? So your face would run you, let's just pick probably somewhere around $1,600 per treatment. You need to do 3 treatments, but then you're good for about 2 years or so. And then you come back, do 1 treatment, not the 3. And so you pay the 16, and then you're good for 2 years. Whereas fillers, you're good for 9 months, and you got to put in 2-3 fillers every 9 months, kind of thing.
So Chris, so you could do that on your hands. You could
we do all the time for hands. Yeah. this area here, like this crepey area here, up in
Yeah.
the arms,
Yeah.
hand, buttock, thighs, knees. We've done it all over the place.
Okay. Amazing. Let's go back to talking about cellulite you mentioned. What's the fucking deal with cellulite? And
Yeah,
like,
yeah,
how
yeah.
do we get it to
That's
go
another
away?
thing. If I could get rid of cellulite, oh my God, I'd be a trillionaire again. The issue with cellulite is has really nothing to do with your exercise and all that other stuff. It's really a structural issue, right? So it's three things cellulite. So think of, here's your skin and here's your muscle underneath, right? There has to be a way for your skin and the muscle to connect with each other in order to prevent your skin from, say, falling off your buttock or off your hand. You need some sort of barrier to keep the skin there, right?
Yeah, makes
So
sense.
there's these little collagen bands that basically attach your skin down to muscle tendons, whatever you want to call it, kind of a thing, right? And that, so as those bands stretch or get shortened, it puts pressure on the skin. So cellulite is three things. It's thin skin at the top. It's a bunch of these bands that basically get either shortened or elongated, and then a bunch of fat gets stuck between the bands. So the way, think of it, the bands are kind of like a little apartment building. So think
Yeah.
of it as let's think of cellulite on your buttock. So you've got think of your buttock as a whole series of apartment buildings, and the walls of the apartment buildings get shortened as you age, and all the fat gets stuck in there, and it all bubbles up on the top and looks like cellulite. So
Right.
you got to do something that's going to affect the skin. You got to do something that's going to affect the bands, and you got to do something that's going to get rid of the little bit of fat. So cellulite is very, very hard to get rid of. There's lots of machines on the market to help get rid of cellulite, cellulase, sulfina. There's lots of little things like that, but there's nothing that is really going to affect it significantly. So cellulite's graded on a scale of 1 to 4. So think 4 is like super bad. 1, pretty well everybody's got some grade of 1 cellulite. Any of those treatments are really going to bring you down like 1 level. So my theory to people has always been this: if I'm a 4 and my cellulite's really bad, save your money, because a 3 doesn't look so hot either, right? So you're going to pay a lot of money and you're going to get a bit of improvement, but really it still doesn't look so great. If your cellulite's somewhere in the middle, a 2 or a 3, going from a 3 to a 2 or a 2 to a 1 gives you a visual significant improvement. That's the type of people that benefit from those treatments. The other one is if you're a 1, then save your money. If you're really bad or not so bad, save your cash. If you're in the middle, then some of those treatments may work.
What about those roller things? You know that you can roll, like you can roll your cellulite
Yeah,
out. Does that
yeah.
work?
Yeah, they work if you're going to, let's say you want to go to Jamaica for the weekend kind of thing, right? You know, you're on holidays and you roll out your skin. So really what you're doing with those machines is you're just redistributing water. So you're pushing all the water from one area to the other. Eventually, a week down the road, the cellulite will come back again. There's a lot of new machines on the market, the high frequency ultrasound machines, Thermage. There's a new one on the market now called Softwave. I have no sort of experience with it, but I was just in Dubai talking to a few people there, and they love the machine. I'm gonna try it out here and see what it's like. But that seems to be the next generation, these high frequency ultrasound machines that are coming on the market.
Okay, and is it just me? But men don't seem to be walking around with a lot of cellulite. Like, what gives with that?
Yeah,
Is that a thing?
men generally don't get a lot of cellulite, and it's really a structural issue. So think of those bands that are like this, right? They're holding the skin down to the muscle, and here's women's bands. So anything that affects those bands and shortens it, it's like closing down on that apartment, right? And forcing all the fat up to the top. Men, their bands tend to go on a bit of an angle. It's sideways, so when they pull, they don't pull down and trap all the fat. So it's strictly a structural issue between men and women.
Okay. Let's talk about someone's lost 60 pounds, 80 pounds, 100 pounds, 120 pounds. Obviously, the way people lose it will
Right.
make a difference. Let's say someone is left with a considerable amount of loose skin. Of course, they can continue to eat healthy. Their skin will regenerate. They'll be able to work out and tone certain areas. But above that, how long should someone wait before they consider weight loss, like skin surgery? And what are options for that?
Yeah, that's a great question because everybody always wants to, my theory, and it's just my theory, right? So I know myself that if you lose, let's say 10 pounds, it's really hard to keep that off, right?
Mhm.
So my theory is always tell people, listen, whatever your goal happens to be, make sure that you're sort of stable at that weight for a couple of months, and then that's the
Yeah.
time to really do your surgery. Never do
Okay.
anything on the extremes, is what I tell people. Don't do anything
Yeah.
if you just all of a sudden put on a ton of weight. Don't do anything if you just lost a bunch of weight. In
Yeah.
reality, let's say, so there's a billion things you can do for skin, but let's assume you're going to do
Okay.
something like a tummy tuck, let's just say, right?
Yes.
Because
Yes.
most people kind of know what the general gist of a tummy tuck is. So I always tell people do the tummy tuck when you've got about maybe, say, another 4 kilos, another 10 pounds to lose after that. So if you
Okay.
do the tummy tuck and you lose another 10 pounds, then you're going to get a really good result. If you
Mm.
do the tummy tuck and you put on another 4 kilos or 10 pounds, your results are not going to be as great. So
Okay.
so I would say the first one would be make sure it's a weight you're going to maintain. But
Yeah.
if it's close to that, then do it at a point where you're going to lose a little bit more, not put on a little bit
Interesting.
more afterwards.
Okay, so maybe go for a goal, maintain that for a while. If you want to go for more, then do the procedure of whatever it would be, and then continue to lose, rather than wait till you reach that goal and then book that appointment right away. Right? We want to
Right.
give the body
Yeah.
some time.
Yeah. And then what you see with a lot of, you see, and I personally see this all the time. Somebody comes in, they've lost a whole bunch of weight, they get their surgery, and then they come back like 6 months later and they put on like 30 pounds because they just
Yeah.
couldn't maintain that weight. Right. So, and
Yeah.
then they just wasted a whole bunch of money and the results of their surgery. And then they got to start the whole process all over again, kind of thing.
Just another reason why putting that time into maintaining and solidifying your weight is so important. What's the difference between a tummy tuck and full-on skin removal? Like what are we tucking and what are we removing? If we have
Yeah.
like a lot of women have that the kind of the apron belly after losing weight from
Yeah.
having kids. And so what's the difference between those two?
Yeah, so there's so many. Everybody's got their kind of 360 this or that, and a lot of it is really smoke and mirror games kind of a thing, right? So really, it's going to come down to this. It's going to come down to how much extra skin and fat you have, and where that's positioned is going to be
Okay.
your best. It's going to determine what type of surgery you're going to go through, right?
Okay.
Because sometimes you see somebody comes in for, let's say, a standard tummy tuck, but if you think of your belly button as the equator, right? So anything below your belly button to the pubic hairline is very easy. Anything that's in that way, fat, skin, everything is easy for a surgeon to get rid of. That's kind of
Oh,
your standard tummy tuck, let's call it.
okay.
Well, let's say a lot of times people lose a lot of weight, particularly specifically massive weight loss. They have a lot of skin above the belly button, like a roll
Wow.
underneath the breast and another roll on top of the belly button. Those rolls are very difficult to get rid of because you're not getting rid of those rolls with a standard tummy tuck. That's when
Mm.
you got to look at doing something different. So let's say you need to maybe do, and we'll go into these in greater detail, like a fleur de lis type tummy tuck where you're removing skin all the way from the breast all the way down to the pubic hairline.
Okay.
And then let's say some people lose a lot of weight, but all their skin and their fat is in their back, right? So it's like above their buttock or their love handle area. Then sometimes a standard tummy tuck won't work for that. That's when you have to do like a 360 body lift. So and all the yeah, so 360 body. So think of
Sign me
yeah,
up. People are give it to me. What's a 360 body lift?
yeah. So let's say you're doing a standard tummy tuck is really this. You stand up. In a standard tummy tuck, you can remove the skin, the fatty component between the belly button and the pubic hairline,
Okay.
right? So what happens is you make a hole, you basically cut out the belly button, you leave the belly button where it is, and you pull all that skin down. So the little hole where your belly button was used to be up here, that gets pulled down to basically your pubic hairline and gets
Okay.
rid of. You make a little hole back up where the belly button was. You bring the belly button up and sew it in through there, right? And then you
Yes.
tie all the muscle back together again. That's a standard tummy tuck.
Okay. Where you're kind of pulling things down.
Yeah, you're pulling things down. But that
Okay.
may not work well if you've got a lot of skin on the sides, on your flanks, and a lot of skin on your back rolls, let's call it, right?
Yeah. Yeah.
So a standard tummy tuck only affects the front of your body. So when you do a 360, you do a tummy tuck, and then basically the patient gets turned overwards, let's call it, and then you basically remove the same amount of skin off the back that you removed off the tummy tuck, off the front.
Mm.
So you're not only are you getting the sides, so you're getting your thighs sort of pulled up a little bit, you're getting your left hands, you're getting everything done. That's
Yeah.
somebody generally those are like people that lost 100 pounds, 50 kilos. They're like big weight loss. That's what's basically called a 360 skin removal. 360 liposuction is just liposuctioning 360 around in a big circle kind of a thing.
Okay, so the tummy tuck and the skin removal, what are we talking recovery time and and cost? And is it
Yeah,
covered by OHIP? Is it covered by anything for people? I know we have we're in like 52 countries, so it
yeah.
depends on where they live, but recovery time and cost for something like this.
Yeah, so the recovery time is about the same pretty well for all those procedures. It's around 6 weeks is full recovery.
Oh
So what
wow.
I found over the years is most people depend. Let's say you had a standard tummy tuck. So the tummy tuck just it goes over removing all the skin and then tying your muscle because you get what's called a rectus diastasis, particularly for women that have had kids. Here's your
Yeah.
rectus muscle. There's your rectus muscle. You can feel them right in the center.
Yeah. Yeah.
Sometimes if you try to clench your abdominal muscle, right, like you're valsalvaing, like you're sitting on the bathroom, and you really got to, and you clench your stomach, you put your finger there. Sometimes you can feel a gap between the muscles. That's what we
Yeah.
call the rectus diastasis. So that basically means how far your muscles come apart. When your muscle comes apart, then you stand up. You get that sort of you get that kind of beer belly look where your belly just sort of falls out,
Yeah,
right?
like barrel I call it like barrel belly on women, and I've had
Yes,
some clients in the past where they're constantly they just have that kind of round, thick belly, and it's not fat, it just looks like structure, and they're losing weight, but that doesn't go away, and then this is
right.
where they actually have an issue with their stomach muscles kind of open
Yeah,
after
so
some
the
procedure.
muscles are say over here, and now we're taking them like this and putting them back together again, right? So that's
Yeah,
basically so it's the tying of the muscle back together again that really determines the recovery time. Because if you go back to exercise too fast, you're pulling on those muscles are just going to come apart. So
mhm,
generally, let's say full recovery, so you're full out at the gym, doing everything you want to do, sit-ups, push-ups, all that stuff. Generally, about 6 weeks for pretty well all those big procedures.
okay.
most most people are able to drive themselves around, like function within about a week. So the first week is generally a little bit bent over kind of a thing, a little bit uncomfortable. Generally by about a week down the road, people are able to drive themselves around, but
Wow,
full out at the gym is around 6 weeks.
okay, and cost?
Cost varies like tremendously, really depending on the what's involved with the procedure. So it could be anywhere from ten to $40,000. Really, it really does come down to if you think of the bigger the surgery you do, like say like a full circumferential body lift. You can't really do that out of the hospital. It needs to be done in the hospital because you need to be generally in hospital for a day or two afterwards. You need some good care. So you got to factor in all the costs of all that stuff. Generally, none of that in Ontario. We have OHIP or Ontario Health Insurance Program, the government program. That none of that would be covered under OHIP.
Should be. Especially
Yeah,
if you can prove that you've gone about losing weight in a healthy way. I think this conversation is so important. I mean, I don't even know what percentage of our members would need that or would be interested, but I think we always have this thing in the back of our mind. Like in working with people and losing weight, well, if this doesn't work, I'm just going to get liposuction. I'm just going to get all my fat cut off, or like skincare. Oh, I'm just going to get a facelift when I'm older. And I think people need to know the reality of what they are talking about and dealing with. If that's your plan B or C and in your back pocket, this is where, rather than me waiting for my Catherine from YNR facelift, I could maybe just use some nice skincare products and take care of my skin now. And you know what I mean? Or when
right.
it comes to losing weight, really, really understand the importance of losing weight in a healthy way. and allowing the body to adjust and putting time into maintenance. Like that's before you even get to these surgeries or these big things. There's a lot that you can do to be proactive about this before you get to that point. Let's talk liposuction,
Sure.
because one of my favorite things in talking with you about liposuction is it's not a weight loss thing. Like
No,
you're
it's
not.
not. No.
Yeah. And what do you mean by that? Like you don't do liposuction to lose weight. This is such a huge conversation. So what do you mean by
Yeah.
that?
So liposuction, we talked about this many times. Don't ever think of liposuction as a weight loss procedure, because it really isn't, right? You can remove literally liters and liters of liposuction off of somebody, and you're going to lose maybe, weight wise, a kilogram or something. Like think of fat floats, right? So
Yeah.
if you take fat and you put it in water, it doesn't sink, it floats. So you can remove lots and lots of fat. You're not going to lose a lot of weight. Think of liposuction really is kind of the ultimate body contouring. Think of it that way, right? So listen, I've liposuction works great for somebody. Listen, I go to the gym. I've been in the gym for 3 years, and whatever I do, I can't get rid of my love handles, or I just got these stubborn inner thighs, or I can't get rid of my chin. That's like liposuction works perfect for people like that. But if it's like, listen, I got to get rid of 30 pounds, liposuction is not the route for that.
That's so huge. Liposuction is not weight loss. It's body contouring.
Right.
So what is a weight? Like if I came to you and I'm like, I got to lose 100 pounds, what can you do for me? Like what would
Yeah.
your response be?
I would say nothing. Go call Gina. Because in reality, listen, you can do a big, we talked about the tummy tuck. There's a lot in the 360, right? Like,
Yeah.
let's say we remove a 360 skin, right? So let's just pick a tummy tuck, because most people kind of know what a tummy tuck is. You can remove a large amount of skin, right? You can remove like a good, foot, 20 centimeters of skin this way, and,
Yeah.
a good couple of feet laterally. So you're getting a good swath of skin. And when you weigh that, it maybe weighs, 1.5 kilos. So let's say
Yeah.
3 pounds tops, maybe
Wow.
4 pounds. Like if you do a huge, big circumferential, maybe you're going to get 10 pounds if you're lucky, but that's a massive, massive surgery. So people
Wow.
have this perception that, that they're going to lose 30 or 40 pounds by just removing a bunch of skin. Your skin, in
Mhm.
fact, really doesn't weigh that much.
Okay, amazing. So let's go back to liposuction. Say, and a lot of women, like when we get C-sections, it's like I don't know if it's the scar or what it is that
Yes.
tends to just doesn't go away.
Yeah.
Is that the scar? Is that just is that something liposuction would help? And then what would be involved with that, and how much would that cost?
Yeah. So the C-section scar drives a lot of women crazy, right? Because what happens is sometimes the scar gets stuck down underneath, and it gets stuck down to the muscle. Once it gets stuck down to the muscle, it makes that little ridge, and then all the fat just builds up inside that ridge, and you're putting on a
Yeah.
nice dress or something, and you just see that pouch around there. So lots
Yeah.
of times we can just do liposuction, lower abdomen, and get rid of that. You can improve it. So generally with liposuction, think of liposuction as this. Here's your skin, here's your underlying muscle, and there's obviously the fatty component in the middle of it.
Mhm.
With liposuction, you can generally remove somewhere in the range of 50 to 70% of the fat between the skin and the underlying muscle. If somebody tells you you can remove 100% of fat, it's technically true, but you don't ever want to go down that route. You don't want to go down, you need fat to make you look normal, and you need
Yes.
fat to basically give you some shape. If you come right down to muscle, and you see it a lot of times, particularly young women that go overseas, they go to Colombia or something like that, and they just get some super aggressive liposuction, remove all the fat. Now the skin's stuck, and it'll be stuck there for life. And
Mhm.
you're going to pay for it later on in life, and it looks terrible in a younger age. So you never want to remove all the fat. You want to remove 50, 70% of that fatty component between the skin and then the underlying muscle.
And then what happens when you gain that weight back?
So once you've created a new shape, right? So let's say you've created this. So one of the big fallacies is women always tell me all the time, if I do liposuction on my abdomen, and then if I put on some weight, my rear end's just going to get bigger, right? And it's not that the fat's going to go to your rear end. Well, it's going to go everywhere, but you've
Right.
created this new shape, right? So
Yeah.
if you liposuction your abdomen, it's not going to go as big as it would previously. It's going to go
Yeah.
bigger. But all the body parts that weren't liposuction are obviously going to get bigger as well.
Yeah. So that's taking the fat out. What about putting it back in? What can you do? I'm reading some of the comments, which are amazing. I love our community, by the way. They're honestly the best. But what about, when people lose weight, they lose a bit of their boobs, they lose a bit of their butt, they lose like their face. Like what can
Yeah.
they do to build it? Like what can they do? Can they do anything? Can we
Yeah.
take our
Oh,
fat
yeah.
from our butt and put it in our boobs? Can we
Yeah, for
do anything?
sure. Yeah.
What can we do with that?
There's lots of stuff you can do. So we do lots and lots. I've done lots of research and I've designed some product. We'll talk about some of the products I've designed for some pharmaceutical companies. So we'll just take breast as an example because it's probably the
Okay.
easiest one, right?
Yeah.
So you lost a whole bunch of weight, and now your breasts get a little bit sort of saggy, and then it's basically what you find from a lot of women is that upper pole hollowing right here, right? So they put
Yeah.
on a nice dress, they put on a push-up bra, and they just get a big hollowing in their breast, right? So now you got to figure out how to fix that. You can either fix it with an implant, a breast implant, which we sort of all know about. You can fix it with fat, so you can take some fat out of other parts of your body and put fat into the area. And then I've been working with a filler company, and we designed some products that we got Health Canada approval for use on the body. And I've been filling up your breast with hyaluronic acid. So same stuff you put in your cheek or your lips, we're using it for breast and buttock augmentation now. I was just in Dubai training a whole bunch of Middle Eastern surgeons on how to do the procedure. So those are really the options. They each have their pros and cons. The most one that everybody's heard about is breast implants. It's very simple. You get whatever silicone breast implant, a saline breast implant. You pick a size. You go ahead and do the procedure. Fat grafting has been around for a long, long time. Fat grafting. So what you're doing with fat is you're taking fat out of anywhere. It doesn't matter what part of your body. Take the fat out of the part of the body, inject it into the breast.
Mm.
Fat's a living entity, so it requires a blood supply. It's not like an inert breast implant, right? So fat requires a blood supply for it to survive.
Okay.
So you put a bunch of fat in. Let's say you put a liter of fat in. Really, about maybe 200 cc's of that liter was really water. So you really only get about 800 cc's of fat in there. And let's say 60, 80% of the fat that you put in survives because it needs a blood supply to hook it up to.
Yeah.
So fat grafting is very variable from patient to patient. Some patients it works great, some patients it doesn't. You have to be very diligent about no exercise and no sleeping on your stomach and stuff like that. And sometimes fat you have to do multiple times in order to get to the size that you want to get. So
Okay.
fat's not going to give you lift. If your nipples are down and you want your nipples up, you either have to surgically lift them up or you need something that pushes them up. So a breast implant will push them up. Fat will only give you volume. Fat won't give you lift.
Okay.
Right. So, and then the other one that I've done for a lot of people is the hyaluronic acid filler. So there's no downtime, just like you're getting your cheek or your lips done. We put some filler in your breast, and that basically expands like it would your cheek or your lips and lifts up the breast. So that's great for women that say they're an A cup, they want to go to a B cup, or they got a little bit of sagginess. They don't necessarily want big surgery. They don't even know if they want breast implants. They just want to sort of, let's call it, try it out, right? So it's like in the worst case scenario, you don't like it, 2 to 3 years down the road, they're gone, it's all dissolved, and you're back to normal again, kind of thing. Worst
Yeah, I
case
love this
scenario,
conversation because women are all the time like, I wish I could take, fat from my ass and put it in my boobs and do all that. Like, and this is what I love about our conversation right now is I think that we have a lot of these conversations in jest, but we also think it's in the back of our mind. And, I'm reading some of the comments and some people are like, oh, it's got me a little nervous and I love the conversation, but I'm depressed. I mean, that's not what this is about. This is about having a really real conversation. For example,
for sure.
some of you have stretch marks. There are some things that you can do that can make a bit of a difference, but also you could just accept yourself the way you are. Some of you will have some cellulite. You know what I mean? Yes, you can go to the gym and tone. There's also a lot of things you can do to help in all the little ways. But this is about having a big, real conversation about all of this. And I think the biggest takeaway from this conversation today, and I'm not done yet, is that losing weight in a healthy way is definitely a game changer, as opposed to starving and depriving and, restricting and trying to follow a quick fix. You know what I mean? So I think it's important. I think it's important. Again, like if I just keep waiting on my facelift, do you know what I mean? And in the meantime, my skin is getting worse and worse and worse and worse. When all this time, there's little things I could do to make it look great along the way. You
Yeah.
know?
Yeah, and if you take something like a facelift, right? In reality, there's so many myths and fallacies about facelifts in general. People think, oh my God, listen, I'm just, like you said, I'm going to wait when my skin looks crap or whatever, and I'm just going to wait. And at one point in time, I'll do a facelift and that's it. I'm done, right?
Yeah.
And that's the farthest thing from the truth, right? Think of all body parts, but just think of your face since we're talking about it. Your face is really a combination of your skin, your fat, the underlying muscle, and your bony structure, right? So if you want to look great, you have to address all those issues. You can't just address a single issue, right? So if your skin is all leathery because you've been lying out in the sun and you never put moisturizer on it, and you're like, oh my God, and then somebody pulls it super tight for you, you still look like you look like an alligator, but you're pulled tight, right? So you need to do something along the way to make sure that your skin looks great. Because even when you do a facelift and you pull tight, a facelift will pull you back, but it won't give you forward dimension. So you still may need fillers and stuff like that for your cheeks and your lips and stuff down the road. So yeah.
Let's talk. I'm watching the time, about 10 minutes left with you. Well, let's talk about skincare ingredients. So one of my favorites that I use is SkinCeuticals. It's the C-Frulic. I get it from you.
Yes.
I love, the SkinCeuticals, like under eye cream for those dark circles. I mean, I find these are great, which I'm going to be giving away in one of my favorite things giveaway. I use some La Mer, which ain't cheap, but it tends to really work for me. I use like a retinol, every now and then. Like what, do you have a favorite skincare line? And if not, is there like, what ingredients? Because you go to Shoppers Drug Mart and you're just like what the, you know what I mean? Or because or you get to see a skincare expert because you get a referral from your doctor, or do you know what I mean? And then but what do you recommend? What do we need to look for?
I think excuse me. So really the difference between a medical grade, let's call it, like a SkinCeuticals skincare line versus just getting something off the shelf at Shoppers Drug Mart. It really comes down to the active ingredients, right? And how active, for a lack of a better word, those active, or how strong, let's call it, those active ingredients are, right? So if you take something like a retinol, let's say, right? So retinol is really kind of vitamin D. Think of retinol. Retinol is kind of like, on a scale of 1 to 10, it's like a 10. It's like a heavy duty puncher. Like it's really gonna, if you want something aggressive to go at your skin, then retinol is the kind of route to do it. But retinol, see, you can't just go to the store and buy a retinol because you're really going to screw up your face. It's going to get really dry. It's going to get really irritated, and you're just going to give up on it, right?
Yeah.
So retinols are one of those products you want to start at a low concentration, and you want to do it every second or third day and work yourself up to a higher concentration and every day kind of thing. So that's kind of really where if you really want to be active and you really want to participate, let's call it, in your own thing, then you want a medical line. So SkinCeuticals is great for that. If it's just like, I really don't want to put the time and investment into my skin, I just want some good moisturizer, then that's more of the Shoppers Drug Mart or your drugstore, for a lack of a better route for it. And so you may find that you get retinol off the shelf from Shoppers, but it's like 0.0001. Like it's there, but it's like non-existent, let's call it. Whereas a true skincare line will have like a real value of retinol, like 0.1, 0.3, 0.5. But even though those numbers seem very small, like the difference between 0.1 to 0.3, in reality, that's super strong on your skin. So you need to kind of know what you're doing when you start playing around with things like that. And I personally think there's some really good medical lines. SkinCeuticals obviously been around for a long time. They're a great line. Oh my God, I'm just trying to think of the other one. There's an Australian line that came to Canada recently that's an amazing line as well. It'll come to me in the middle of the night when I'm sleeping. I'll phone you at 2 a.m. and say, oh my God, that's what it was.
And a lot of people know, well, I pick mine up from Hammam Spa, which is where
Right.
you're also working at a Hammam Spa. Do they carry those? They carry that there, right?
Yes. Elastin. Sorry, Elastin is the other.
Elastin.
Yeah, Elastin.
Yes,
Yeah.
yes,
It's great.
yes.
It
Okay.
really is a good skincare line. But
So
like take a skincare line like Elastin, just as an example, right? Awesome skincare line, pricey. It works, but you got to put the time and effort, and not like 2-3 weeks into it. You're talking like 6 months of using it. Then you're going to see the really good results down the road, right? And you have to put the time, the effort, and the money into doing it. It's just not a one-off kind of a thing.
Okay, that's good to know. Like how long it's going to take to see a difference in your skin, because your skin's always regenerating. So I would assume that if you are consistent about your skincare, you're going to notice a difference in it.
Yeah, so think of it, your skin basically turns over about every 3 months, right? So if you're going to try a new skincare line, you're going to try a new shampoo, you're going to try whatever, you generally got to go through that 3 month cycle and see how it works. So it's not like, oh, I tried it for a week, I didn't really like it, let's move on to the next one. If you're going to
Mhm.
really give something a really good go, you got to give it that 3 months.
Okay. Do women, the men too, do our hormones affect our skin as we're getting older? Do you like, is it different? Like someone's coming to you as a candidate would like age, so you have someone healthy, but maybe they're a little older. Is that going to,
Yes.
obviously the wear and tear on their skin, but how much is our hormone? Because our skin changes when our hormones change. Why?
Yeah, for
What's going
sure.
on?
Yeah, I would say, I would say hormones. I mean, I know a fair amount about hormones, but I'm not like a hormone guy. I don't prescribe them or
Yeah.
anything like that. But definitely as you age, particularly as you lose estrogen or testosterone, that definitely affects the quality of your skin. So I wouldn't say personally. Listen, if you're looking to really ultimately improve the quality of your skin, should you go on like hormone replacement therapy? I wouldn't say that, but
Okay.
definitely it does. Those hormones definitely affect your skin as we age, for sure, both men and women.
Okay. I got two more questions. Skin
Sure.
tags, skin tags and
Yes.
mold. Why?
Yeah, yeah, mold. So,
Why?
so I used to, when I was in residency, they we used to talk about moles, right? Like moles are, and somebody would always say it's a nevi, not a mole. A mole's an animal that lives in a hole. This is a thing that grows under your skin. So basically, as everybody gets them, everybody gets skin tags. Nobody really truthfully knows why people get skin tags. You generally tend to get them in rough areas where the skin's rubbing all the time. You get them in your underarms, you get them around your neck and stuff like that. That's one of the theories behind them. Skin tags you can buy over the counter stuff, but you can easily get your family doctor. Anybody can just snip them off, the skin tags. So really, you just don't want to wear something that's like, say, super tight all the time for your underarms, something that's going to rub all the time, because that generally tends to
Mm.
contribute to it. Aging spots like moles. Moles are there's so many different types of moles. I mean, it sounds stupid, but here's all the layers of the skin. Some of the moles just sort of sit on the top of the skin. They're generally called what we call seborrheic keratoses. An exam question for dermatologists and surgeons is always it looks like a wax on stucky appearance. So it looks like
Okay.
you just took something like a black thing of wax and stuck it on
Uh-huh.
your skin. That's a
Yeah.
seborrheic keratoses. They're easy to get rid of. Sometimes moles go deep into the skin, and if you just superficially take the top off, it regrows. The mole's got the hair growing out of it. You
Yeah, I
generally
have
gotta,
one.
you generally got to cut that out and get the hair follicle out, close it over. But
Yeah.
remember, a mole's a circle, right? So there's your circle. When I take a circle and I cut out that little, let's say it's just a centimeter long, right? When I cut out that circle, now I got to close the circle. When I take that circle and I close it into a straight line, so we'll do that, is that the circle gets bigger. So if your mole's a centimeter, the scar from removing a centimeter mole is generally about 1.5 times the length of the mole. So the scar is always bigger than the mole.
Something to think about. I'm still gonna come see you and get this thing taken off the side of my face. Um, Puffiness under the eyes. Puffiness under the eyes. Why do we
Yes.
get it? Is it from just
Yeah.
drinking red wine? Because it tends to pop up whenever I drink
Yeah.
red wine. What's it
If you
from?
if you a couple of things about that. So if you get it chronically, and maybe it's so sometimes associated with headaches or not, and it waxes and wanes, it comes and goes, you should really have your sinuses checked to make sure that you don't have a sinus congestion, because you can get puffiness under your eyes. Very, very common. Nobody ever thinks about it. So make sure that it's not a medical reason why you're getting it. You can get a thing called blepharochalasis, where you get basically kind of like an allergy, let's call it. So you just want to rule out those sort of medical things and make sure that's not the cause of it. And then you have to look at, can you mask it with fillers versus surgery to get rid of the or PRP. There's lots of things you can use for under eye wrinkles.
So it's not necessarily that I'm just not getting any sleep, or I'm just like,
yeah, basically. So just one, make sure that it's not medical, and or you have what's called a big festoon. So sometimes you see, a lot of times people will get injections done under their eyes, but right over here on the corner of their eye, I do tons of cadaver labs internationally teaching people anatomy and stuff. There's a little fat pocket here called a festoon. Sometimes new injectors, when they're injecting under the eye, will also inject into the festoon. It's a fat pocket with not a big blood supply to it, so the product never goes away. So sometimes the puffiness is really because of a product that was injected into there, and you have to dilute the product out. So.
Okay, our time is up. I love you. I love our conversation. I know people are going to say, where can they find you? So where can they find you? I know you're a busy man, and
probably the easiest is just through the website. I'm just working on my new website, should be up soon, drshawnrice.com, or the Hammam Spa. You can get me there as well.
Yes. I want to do a thing. I want to come see you and bring our production team and come see you. And
you got to come to this.
Yeah, and I'm a massive fan of spa, and our new conversation all about self-care and doing all of that. So I definitely want to come and see you. Thank you so much.
No problem. Anytime. My pleasure. Always enjoyable.
Thanks, everyone. Thanks for listening. Dr. Rice, thank you so much. Love you. Have a good day, everyone.
Love you too.
Cut. Yeah. Awesome. Gina, we have to just do the YouTube CTA.
What's a CTA?
But like you've seen YouTube before, right? Okay. Like you encourage people to subscribe to your channel, check out other videos, things like that.
Like me, love me, click here, watch our shit. One of those things.
Yes.
Okay. Subscribe here.
Don't point to a subscribe button. I don't know what it's gonna be.
Subscribe here. Okay. Let's do that again.
Do what again?
Where you point to the thing. Subscribe.
I haven't done it at all yet.
Thanks for watching. Subscribe somewhere. Here, where's it gonna be?
Just like it's gonna be, there's gonna be a picture of you that they click on.
Thanks for watching. Subscribe on my face. Is that what we're doing? Thanks for watching. Subscribe.
You have to tell them why.
We'll let you know when we have new stuff. And go to our website. That wasn't it, was it?
Cut. Are we using that?